If you're a veteran with VA benefits, you may be wondering how these benefits work with Medicare, or whether or not you even need Medicare at all. And these are the types of questions I'm going to be answering today, so stay tuned. Hi, my name is Stephanie Apt. I am a licensed insurance professional specializing in Medicare. And if you're new to this channel, I create these videos to answer some of my most frequently asked questions and to break down the different parts of Medicare. If you find value here, I would love if you would take just a moment and subscribe to the channel if you haven't done so yet. You can like the video and definitely leave all of your questions and comments for me below. I really love hearing what you have to say, and doing those things helps these videos to be seen by people who can hopefully benefit from this information. In today's video, I'm going to break down the basics of how VA coverage works for people that are eligible for Medicare. So today we're going to go over whether or not VA coverage and Medicare benefits will work together, deciding if you need Medicare when you have VA coverage, as well as breaking down some of the best Medicare options for veterans. If you are a veteran, then you may be eligible for VA benefits. VA benefits are administered by the federal government and include pensions, health care, as well as other benefits. And it's important to know that VA benefits do not work with Medicare, although you can be enrolled in both. VA benefits cover care mainly at VA hospitals and outpatient clinics, VA medical centers, and VA nursing homes. And veterans can receive care at any VA facility. Health benefits include coverage for medical and mental health care, home health care, nursing homes, and even some Medicare excluded services can be covered by the VA. Things like annual routine physical exams, eye examinations, and hearing aids. So one big question that I get asked a lot is, if I have VA benefits, do I need Medicare? So if you have VA benefits and you're eligible for Medicare, no, you are not required to enroll in Medicare Parts A and B, but you may have good reasons to want to enroll in Medicare. Even the VA itself strongly recommends that veterans enroll in Medicare Parts A and B when they are first eligible, unless they have group health insurance through a current employer. Now, for most people, Medicare Part B isn't free. So in 2022, the Medicare Part B premium is $170.10 per month. But here are a few reasons that you may want to go ahead and enroll in Medicare Parts A and B and pay that premium, even if you have VA coverage. Reason number one is that you may be subject to penalties in the future. If you don't enroll in Medicare when you are first eligible and you don't have other creditable coverage to delay enrolling in Medicare Part B, then you may face penalties down the road if you do decide to enroll in Medicare at a later date. And VA coverage does not count as creditable coverage to delay Medicare Part B. So if for some reason you lose your VA coverage in the future and you decide you want to enroll in Medicare Part B, you could be facing lifetime penalties. Reason number two is that having both Medicare and VA coverage gives you more options. With VA coverage only, you're typically restricted to using only VA doctors and hospitals to receive your health coverage. And if you need to go elsewhere, you may be responsible for the full cost of the service, even if it's an emergency. Having Medicare coverage in addition to VA benefits widens your coverage options and gives you the opportunity or the choice to use non-VA medical providers. The third reason is that VA coverage isn't always set in stone, and it isn't the same for everyone. The VA currently designates different levels for different enrollees based on income and medical conditions. If federal funding for VA health benefits drops, then some veterans in some of the lower level priority groups may lose their VA coverage completely. And as we just reviewed, right now, losing VA coverage is not currently considered a qualifying event to enroll in Medicare without penalties. Now, some people are perfectly comfortable foregoing Medicare and they plan on using exclusively VA doctors in hospitals, and that's totally fine. But it's just important to know the pros and cons of declining Medicare so that you don't face any surprises in the future. Now, when it comes to prescription drug coverage, things are a little bit different. There is far less downside to delaying or completely foregoing Medicare Part D prescription drug coverage if you have VA coverage. VA coverage for prescriptions is typically less expensive than Medicare Part D drug coverage, and you won't face any penalties down the road if you lose your VA benefits and decide to enroll in a Part D plan, as long as you do so within 60 days of losing your VA coverage. So while VA coverage isn't considered creditable for Medicare Part B to delay that, it is considered creditable when it comes to delaying or declining Medicare Part D, the prescription drug coverage. It's kind of tricky, I know. However, if you do decide to have both VA and Part D prescription drug coverage, you do have the flexibility to use both. This would allow you to obtain prescriptions from non-VA doctors and get them filled at non-VA retail pharmacies. And you may even be able to obtain some medications that the VA doesn't cover. Additionally, you can also apply for low-cost prescription drug coverage under Part D's Extra Help program if your income falls into a certain category. And I'm going to link more information in the video description below about that. So if you do receive VA coverage and you also want to enroll in Medicare, you may be wondering what are the best options for you when it comes to Medicare supplement insurance or Medicare Advantage plans. Specifically, there are certain Medicare Advantage plans that are targeted to veterans, and many of these Medicare Advantage plans don't include Part D prescription drug coverage, assuming that since you have VA prescription drug coverage, you can use that instead. Sometimes these MA only plans, they're called, or Medicare Advantage plans without prescription drug coverage, can have some additional benefits built in that are less common on a traditional Medicare Advantage plan that does include prescription drug coverage. So you may see some additional benefits like a Medicare Part B give back or a Part B premium reduction, among other benefits. When it comes to determining whether you should keep traditional Medicare with your VA benefits or opt for a Medicare Advantage plan with your VA benefits, that is where we can help. My team and I are licensed in almost every state, and we work with both Medicare Advantage plans and Medicare supplement plans. So we are able to take an unbiased approach and really help you find the best plan at the best price to meet your needs. So please feel free to call us anytime. Let us help you. Our service is completely free of charge. In general, I hope you found this video helpful as just a basic overview of Medicare and VA coverage. And if you have any more specific questions, please feel free to leave them in the comments below. I do my best to reply to all of those. Thank you so much for watching today, and we'll see you soon.